A silent killer, prostate cancer frequently goes undiagnosed until it is too late. In the United States alone, more than 288,000 men receive a prostate cancer diagnosis annually. The good news is that over 98% of cases survive when detected early. We'll reveal the important warning indicators and danger factors in today's video so you can safeguard yourself or a loved one. These seemingly little symptoms, which range from frequent urination to sudden weight loss, could be your body's way of warning you of a dangerous condition. This knowledge could save lives, so pay attention. Prostate cancer is a serious issue that secretly endangers millions of lives globally in the complicated realm of men's health. Men of all ages, races, and backgrounds are susceptible to this sneaky illness, which does not discriminate. The startling fact is both frightening and encouraging. More than 288,000 new cases of prostate cancer are reported each year, and over 34,700 men lose their lives to the disease. However, there is a glimmer of light inside this depressing statistic. The survival rate rises to an astounding 98% when discovered early. Realizing that prostate cancer is an illness that affects people differently is the first step in learning more about it. Individual health history, lifestyle decisions, environmental circumstances, and genetic predisposition all interact in a complex way. A common misconception among men is that they are immune because of their perceived good health, age, or level of activity. This perilous misunderstanding has caused innumerable people to ignore vital warning indicators that may otherwise save their lives. The walnut-sized gland that surrounds the urethra and sits beneath the bladder is called the prostate. Its main job is to produce the seminal fluid that feeds and carries sperm. When cells in this gland start to grow out of control, they can create tumors that have the potential to spread to other regions of the body, which is how cancer occurs. Numerous variables, such as genetic predispositions, hormone imbalances, chronic inflammation, environmental exposures, and lifestyle choices, can result in cellular mutations. 1. Frequent urination and nocturia. More than just a minor annoyance, frequent urination and nocturia may indicate underlying prostate problems. Urinary patterns alter in several interrelated ways as a result of these symptoms. Men may have trouble starting to urinate and have an increased frequency of urine, particularly at night. A persistent feeling of inadequate bladder emptying may accompany a weakening or interruption of the urine stream. Some people have sudden, intense urges to urinate that interfere with everyday activities and sleep habits, as well as burning or painful urination. These symptoms are difficult since they might be a sign of a number of illnesses, ranging from early-stage prostate cancer to benign prostatic hyperplasia. Healthcare providers stress the significance of monitoring these urination changes, noting their frequency, length, and effect on general quality of life. Your body may use what appears to be a basic bathroom habit as a vital means of communicating possible health issues. 2. Painful ejaculation. Although sexual health is a very private and delicate subject, painful ejaculation may indicate prostate problems that need to be addressed. This symptom encompasses a variety of events that can have a substantial influence on a man's physical and mental health, going well beyond simple physical discomfort. During sexual activity, males may feel a sharp or throbbing sensation that radiates through their lower belly, rectum, testes, or penis. Painful ejaculation has serious repercussions. Reduced sexual drive, possible erectile dysfunction, and related psychological stress are some of its symptoms. These symptoms are systematic reactions to changes taking place in the prostate rather than single occurrences. Although the severity and length of time may differ, they are important warning signs that call for a thorough medical assessment. Many men find it awkward to talk about such personal health issues, but keeping quiet can be risky and may cause important diagnoses to be delayed. 3. Blood in urine or semen. There is always cause for concern when blood appears where it shouldn't. Hematuria, blood in the urine, or hematospermia, blood in the semen, are signs of potentially serious prostate problems. These symptoms could be the consequence of blood vessel abnormalities brought on by an expanding tumor. Although such symptoms may also be caused by infections or less serious illnesses, The sight of blood necessitates prompt medical intervention. From a faint pink tint to more pronounced red coloring in urine or semen, the visual presentation can vary. Never write off such changes as transient or typical. They indicate a substantial change in how the body functions, which calls for expert medical examination. The causes are numerous and intricate, and they could point to anything from inflammation of the prostate to more severe tumor growths. 4. Pain. While sitting prostate problems can make sitting, an apparently routine activity, quite painful. When prostate enlargement causes pelvic pain, it may radiate to the lower back as a sharp or dull discomfort. The most prevalent kind of prostate cancer, prostate adenocarcinoma, may be the cause of this ongoing discomfort when sitting. Many men initially write such pain off as age-related discomfort or a simple muscular strain. On the other hand, persistent pain that doesn't go away with rest or positional adjustments can be an indication of something more serious. Long durations of sitting or certain activities may make the pain worse, which is a subtle but important warning sign that shouldn't be disregarded. Pain in the back, hips, or chest. The potential of cancer to spread beyond its initial site is its most pernicious feature. Prostate cancer often spreads to the bones, resulting in intense chronic pain in the ribs, hips, or back. Because they frequently signify advanced stage cancer that necessitates prompt and intensive medical attention, these symptoms should not be ignored. Usually, the discomfort is distinct from ordinary muscular aches. Patients characterize it as a severe, ongoing pain that is unresponsive to standard pain management techniques. Some men complain of a persistent pain that gets worse at night or with certain movements, which could be an indication that malignant cells have moved to bone structures. 6. Swelling in the legs or feet. Lower body swelling can be a serious indicator of advanced prostate cancer, even though it may not seem connected to prostate health. Fluid buildup can occur when cancer cells infiltrate lymph nodes and obstruct normal drainage pathways. This ongoing swelling should be evaluated by a doctor very once, especially if it is accompanied by other symptoms. A sensation of heaviness in the legs or trouble moving as freely as before may accompany the swelling. This symptom is especially troubling because it affects movement and overall physiological comfort in addition to the obvious physical changes. 7. Unintentional weight loss. Involuntary weight loss might result from metabolic changes caused by advanced prostate cancer. Due to the high energy requirements of cancer cells, the body burns calories more quickly. This is a serious sign that something is seriously amiss with one's health and is frequently accompanied by extreme exhaustion. At first, weight reduction may seem like a good thing, but when it happens quickly and without explanation, it may raise major concerns. In addition to losing weight, men may experience other side effects, include decreased appetite, chronic fatigue, and generalized physical weakness. 8. Numbness and weakness in limbs. The neurological symptoms that appear when prostate cancer spreads to the spine are possibly the most concerning. Arms and legs may become numb, tingly, and weak due to spinal cord compression. In extreme circumstances, this could result in loss of control over the bladder or intestines, indicating serious neurological issues that require prompt and thorough medical care. These are more than just mild muscle weakness. They could result in the constriction of important neural pathways, which could drastically change a person's mobility and quality of life. In order to comprehend prostate cancer, risk variables are still essential. One important factor is age. Risks significantly increase after the age of 50. Black males are more likely to develop more aggressive forms of cancer, thus race does play a part. Individual risk profiles can be greatly influenced by family history, especially when it comes to breast or prostate cancer associated with particular genetic abnormalities. The best effective defense against prostate cancer is still early detection. Frequent checkups, honest contact with medical professionals, and careful attention to physical changes can all make the difference between a diagnosis that is tolerable and one that is potentially fatal. You don't have to die from prostate cancer. Awareness, early detection, and taking proactive measures for your health are crucial. Keep in mind that little bodily changes may indicate serious dangers. Pay attention to them. Please like, subscribe, and share this video if you thought it was helpful. Let us collaborate to raise awareness and inspire men worldwide to take charge of their health. We appreciate your time, and we hope to see you in the future video.